Every 90 minutes, someone is diagnosed with ALS, and every 90 minutes, someone loses their life to it. It might begin quietly, a flicker in the hand, a stumble on the stairs, a voice that fades ever so slightly. At first, it's easy to dismiss, but over time, what once seemed minor begins to unravel something much deeper. Amyotrophic lateral sclerosis, ALS, is a disease that slowly paralyzes the body while the mind remains fully awake. ALS attacks motor neurons, the nerve cells that send messages from the brain and spinal cord to our muscles. These cells control voluntary movement, walking, speaking, swallowing, even breathing. As the neurons die, the muscles weaken, and over time, they stop working altogether. Around the world, ALS affects about 2 in every 100,000 people each year. In the US alone, approximately 30,000 people are living with the condition at any given time. It tends to strike between the ages of 40 and 70, and while no one is immune, it's slightly more common in men. And yet, its reach isn't just clinical, it's deeply personal. Stephen Hawking, the brilliant theoretical physicist, was diagnosed with ALS at just 21 years old. Told he had only a few years to live, he defied expectations for decades. Though his body weakened, his mind soared, reshaping the way we understand time, space, and black holes. His life became a testament. ALS may silence muscles, but it cannot touch the intellect or the will to create. ALS often begins with signs that are easy to overlook. Muscle twitching, especially in the limbs or tongue. Subtle weakness, cramps, slurred speech, difficulty swallowing. Because symptoms vary widely, there's no single test to confirm ALS. Diagnosis involves ruling out everything else. Doctors use a combination of nerve studies, imaging, blood work, and clinical evaluations to piece together the picture. When nothing else explains the symptoms and the pattern fits, the diagnosis becomes clear. ALS is progressive. It does not stop. Most people live 2 to 5 years after diagnosis, but some, like Hawking, live far longer. Even as the disease advances, the mind stays sharp. The person remains fully aware. That's one of the most haunting and courageous parts of the journey. While there is no cure, treatment can help people live fuller, longer lives. Medications like riluzole and edaravone may slow the progression. Breathing support can extend life and ease discomfort. Feeding tubes ensure nutrition when swallowing becomes difficult. Communication devices, including eye tracking technology, allow people to speak without speech. Care is a team effort. Neurologists, therapists, nutritionists, and counselors, all working together to support quality of life.